Happy Sunday, everybody, and happy Easter holiday season. I hope that you're having an amazing time with friends and family. Welcome to Health Diary. My name is Winnie Lubembe, and we're coming to you from the Aga Khan University. Now, we've talked about malaria time and time again, and I know majority of us would like to travel or have traveled during this Easter season. And maybe you find yourself in a malaria endemic zone. So what are some of the things that you need to do to prevent yourself from getting infected with malaria? Well, you want to stick around until the end of the show to find out. But first things first, here is the fact of the matter.
According to the World Health Organization, malaria is defined as a life-threatening disease caused by parasites that are transmitted to people through the bite of infected female Anopheles mosquitoes. It is preventable and curable. Children under 5 years of age are most at risk of severe complications from malaria. In the year 2023, they accounted for nearly 76% of all malaria deaths in the WHO African region. The theme for this year's World Malaria Day is Malaria Ends With Us, Reinvest, Reimagine, Reignite. This theme aims to raise awareness about the urgent actions needed in the fight against malaria, emphasizing the importance of continued investment, innovation, collaboration, and commitment from the global malaria eradication community.
Well, it's Easter season, and I know majority of us would want to travel home, visit friends or family. But even as we do that, let's not forget that there's this thing called malaria. And we've talked about it over and over again, but it still continues to affect millions of people around the globe, but also taking lives. So what is it about malaria? What is it that we can do to prevent cases of malaria? Well, we have Dr. Adil Suleiman, who's a consultant infectious diseases specialist right here at Aga Khan University Hospital, right here in Nairobi, to help us really understand the measures that we can take to prevent cases of malaria, especially during this Easter season. So, Dr. Adil, thank you so much for making the time. Malaria, can we start with the global incidence? And we've talked about it over and over again, but we're still seeing cases of people losing their lives to malaria.
Yeah, so malaria is one of the most prevalent diseases in the world. In 2023, we had 263 million cases. Yeah. Unfortunately, 94% of them were in Africa. Okay. And malaria caused around 597,000 deaths in 2023, and around 76% of these deaths involved African children. Yeah, so it is a big killer, especially in Africa, and especially of children. Yeah.
I wanted to ask why Africa? Why the big number in Africa? Is it our climate? Is it what exactly is it?
It depends on various factors. The most important one is the kind of parasite which is found in most places. So the deadliest parasite is Plasmodium falciparum, which is majority found in Africa. And the other reason is the vectors, the kind of mosquitoes. So unfortunately, the vectors which best transmit malaria are also found in Africa.
I see.
So that's why we have the deadliest species of malaria being transmitted by the most efficient vector. That's why we have the highest cases and the highest mortality. Okay. Also, the other things will come into place is the socioeconomic status of the patients who get malaria and being able to seek high-quality health care.
Okay. Now, children, can you remind us, because now, again, children have closed schools, they are at home, and even during the Easter season, majority of the times kids will be, transported home, go visit your grandma, go visit your grandpa. So how much of a risk are they, and why are they the most affected by malaria and also pregnant women?
So the kind of risk groups of malaria will actually depend on which kind of region you live in. Okay. So the children and pregnant women are at highest risk in the places where malaria is endemic. Right. And the reason that they are at high risk is because they don't have good immune systems. So children, when they're born, they have some bit of immunity from transmission of antibodies from the mother, so they have a bit of protection. But once that protection wanes, then they have really no defense against malaria. So the only way to develop defense against malaria previously, of course, right now we have some vaccines which have come into play, is to get the infection. So unfortunately, when they do get the infection, they can get really sick, and it can lead to death.
Absolutely. So endemic areas, can we talk about the two or three main regions right here in the country that are very endemic? And also, there's the whole lot of conversation about immunity and the people born in those regions versus people born in other parts of the country and the risk of infection. It's a lot, but help us really understand this endemic regions and the people born there.
Yeah, so we have two main endemic regions. Okay, I'll start with the lake because I think that's the most common.
We know that,
And then we have the coastal. And the reasons these regions are endemic is to do with the climate and the water bodies which are close by, and that they're low-lying areas. So it's mostly to do with the vector. Again, it all comes down to the vector. So the vector thrives in hot climates and where there are water bodies, which will allow it to multiply. Okay? The reason it needs hot climate is it doesn't survive very long in the cold climates to be able to complete the life cycle of the malaria, for it to pick the parasite from one person and then for it to develop in the mosquito and for it to transmit. So if it's hot, the malaria mosquito can survive for longer and be able to carry out the passing of infection from one person to another. So malaria, the ones we have in Africa, is a human disease. So what the mosquito does is just transfer the infection from one person to another. So you need a population of individuals who have the parasite which the malaria can pick and then transmit to the people who don't have the infection, and that's how the infection continues. So in endemic areas, as I said, the main people at risk for infection are the young children because they have really no immunity against malaria, and that's why we see many deaths. But if they do survive and they get repeated infections, then they develop some immunity. So as they grow older, actually you will have children and older children and adults who actually have malaria but have no symptoms. And those are the main reservoirs for spreading infection.
The disease.
Yeah, because if you don't have symptoms, you won't seek health care. And if you don't seek health care, you're just somebody who's spreading the infection.
Interesting. Okay, and the coastal region as well?
Yes, so the coastal region, so mainly we see it in the village areas like the Kilifi and Kwale regions. It used to be there in Mombasa, the island itself, but then it's with urbanization actually that has reduced, and it's also again to do with the vector. The vector does not survive very well or thrive in an urban environment. So it mostly prefers, because of the pollution and everything and the kind of water bodies it needs to multiply. So it mostly thrives in the villages, and that's where the highest risk is. So if you go to Kwale, Kilifi, mainland of Mombasa and all those areas, then you'd be at risk. Taveta.
Just recently I was speaking to a specialist from, I think, the Ministry of Health, and they were saying now we have a new sort of like risk area, and this is like the Turkana regions over there. And that was very interesting because this is like a dry area mainly, but then again, of course, we also have like Turkana, so we could understand maybe there could be a relation to the same.
I think the emergence of malaria in those regions could be due to the introduction of a new vector. I don't know if you saw it in the news some time back about concern about Anopheles stephensi.
Yes.
Yeah, so the ones we have in the lake region is the Finestes and Gambiae, which are the ones which thrive in the villages and are very efficient vectors. The thing about, as I said, those ones, they don't survive very well in the urban environment, but the stephensi one, which actually comes from Asia and has been introduced here, it thrives very well in the urban and peri-urban environment. It can multiply in tires or small water collection. You see, you throw a can, it will accumulate water.
And then,
So it can multiply rapidly, and if malaria is introduced in that population where you have humans, then it can spread the malaria quite efficiently, and that is why probably there is that outbreak.
And then also there's a lot of conversations around malaria and sickle cell, and a lot of people are like, okay, what's the connection? Is there any relationship between the two?
Yes, so actually sickle cell disease thought to have been evolved for protection against malaria. Okay?
Okay.
So for you to get sickle cell disease, you need 2 genes of the thing. So if you have 1 gene, you're actually protected against some forms of malaria. But if you get both, then you get the disease. But if you get malaria, then you're at risk for higher disease severity.
Interesting. Okay, so then we've talked about the symptoms of malaria over and over again, but at the same time, it's one of those diseases that if someone has a fever, the first thing that you think, oh, maybe it could be malaria. Are there other symptoms that we need to be on the lookout for, apart from the ones that we know, say headaches, fevers, joint pain? Are there any other symptoms that we should be on the lookout for, and especially when it comes to children who are mostly affected?
So the most common symptom is actually fever, accompanied by other systemic signs like headache, joint pains. You can have nausea, vomiting, and even diarrhea. So sometimes it can be misdiagnosed as a case of gastroenteritis. And then the symptoms of the severity of infection. So as the infection becomes more severe, then other organs can be affected. Especially in children, it's common for them to get brain symptoms, so they can have confusion or lethargy or seizures. They can have low like sugar levels, which would also affect their consciousness level. In adults, you can have jaundice, you can have difficulty in breathing if it affects, even in children, if it affects the breathing system. And if it affects the kidney, then you can have reduced amounts of urine production and all the complications which come with that.
All right. And what influences, say, the progression of the symptoms?
So it depends on your level of immunity and how long you take to seek healthcare and the kind of parasite. So there are various parasites which cause malaria. The most deadly one is Plasmodium falciparum, and the reason it's most deadly is because it will affect all your red blood cells regardless of the age.
Oh, wow.
Yes.
Okay, how quickly?
So it multiplies in the red blood cells, and then the red blood cells rupture, and then it goes and affects other red blood cells, and it multiplies. So that's how the parasite increases in logs.
Okay.
The other forms of malaria, they can either affect the very young cells or the very old cells. So at one time, you don't have a huge population of very young cells or very old cells in your body. That's why the amount of parasites you can get in your body gets limited, except for people who have sickle cell. Then they could be having a lot of young cells to produce blood which is breaking down. So those ones can get like serious infections with the parasites which affect the very young cells. If you have no immunity to control the infection, then the parasite can multiply more rapidly and cause more complications. And also, like if you get symptoms and you seek healthcare immediately, then there will be a limited time for the parasite to multiply. But if you wait for a while, or you get misdiagnosed, as many people do, and are diagnosed with bacterial infections, then there's there's more time for the parasite to multiply and reach levels where it can become dangerous. Yeah, typically the levels where it becomes life-threatening is more than 5% of red blood cells in those who have no immunity, and more than 10% in those who have some immunity.
Level of immunity. Wow. Pregnant women, what is it that they need to know?
Yeah, so pregnant women are at higher risk for malaria, and especially in the endemic areas. And it mostly affects women who are first-time pregnant and the younger women, because there's a change in the kind of immunity which happens during pregnancy. Unfortunately, getting malaria in pregnancy will increase the risk both to the mother and to the baby, because it can lead to severe malaria in the mother, and then it can lead to involvement of the placenta, which can cause bad outcomes for the baby in terms of stillbirths or growth retardation, which can have bad consequences further on. It can also be transmitted from mother to child, and the baby can be born with malaria.
All right, how about we take a break, and then when we come back, we'd want to understand, fine, so Easter season, we'd like to spend time with friends and family, and especially in these endemic regions that we've talked about, what is it that people need to do to prevent? Because we don't want to travel, have a good time, and then come back and start suffering from malaria, right? Well, all that is coming up after the break. Do stay with us. Welcome back to Health Diary, hoping that you're having yourselves an amazing Easter season with friends and family. But even as you do that, let's not forget that there's this thing called malaria that is affecting millions of people around the globe and children as well. And today we want to understand, and especially those ones in endemic regions, what is it that we can do to prevent, or those ones who are traveling from non-endemic regions to endemic regions? How can you protect yourself against malaria? And we have Dr. Adil Suleiman, who's a consultant infectious diseases specialist right here at Aga Khan University Hospital, helping us really understand more on the same. And Dr. Adil, so we talked about the endemic regions and what malaria looks like in those specific regions. But I know there's so many people who will travel, say, for example, from Nairobi, going to Western Kenya, because I know our community like to travel a lot during this period. So what is it that they need to do and they need to know before traveling?
Unfortunately, every year, after the holiday seasons, we get an upsurge in malaria cases in the hospital, and many of them lead to admissions. And the reason for this is people travel to their homes, especially to the villages where the malaria is very prevalent, and they don't take precautions to prevent malaria, and they end up getting malaria. And then they end up in hospital, sometimes with some complications of malaria needing to admissions. So most of the time when we ask them after we've treated them, that do you know that there's a way we can prevent malaria? And most people are not actually aware that there are precautions you can take beyond the usual ones to prevent malaria. So the two ways to prevent malaria. Number one is to make sure you don't get bitten by mosquitoes. So there's mosquito avoidance measures. And the other way is that even if you do get bitten by mosquitoes, then you don't develop the infection. So that is what we call chemoprophylaxis. So basically it just means taking drugs to prevent an illness. So how you can prevent getting bitten by mosquitoes? It is advisable that around dusk and dawn and between those periods that you should not be outdoors, because that's when mosquitoes are and they're biting. And if you're indoors, it is preferable that if you're in the open, then it should be a room which has screens, like the windows should have screens against, and you should close all doors and windows so that the mosquitoes can't get in, and the windows should have screens to prevent them from getting in. And if you can afford it, which is probably not practical in rural areas to have an air-conditioned room, because as I said, they like warm environments, not cold environments. The other issue is not having many exposed areas. So if you wear clothes, make sure that you wear long-sleeved clothing and long trousers, and then the clothes should be light, because the darkness will attract the mosquitoes. On the exposed area, you can apply mosquito repellents. Also, there are these things called special repellents. So there's one for applying, and there's one you can just plug in, or which can go into the air and chase away the mosquitoes. You can use insecticides. And importantly, if you sleep under a net, preferably an insecticide-treated net.
And then those ones who are traveling from the endemic regions now coming to regions that are not endemic, is there anything that they can do, or them they're safe?
Then they're okay. There's not a big issue with them. The only thing they need to realize is if they're staying in the non-endemic region for a while, then because they're not getting exposed to malaria, their immunity will wane. And then if they go back after several years, then they become at risk for infection.
Vaccines, right? Can we talk a little bit about vaccines and the children and how much of protection it offers? Because like we said, children, pregnant women are mostly affected, or more at risk of developing complications from malaria.
There are two vaccines which have been trialed and have been approved by the WHO, and one of them has actually been used in Kenya. I think it was approved in 2019, and already the results are showing that it is reducing the incidence and the severity of malaria in children. I think they're 4 doses given, I think 6 months, 7 months, 9 months, and 24 months.
Yeah.
And of course, they're given to children who live in the endemic areas, and it's shown to have protection.
Okay.
So that's why it's used where the malaria circulation is high. We wouldn't advocate children in Nairobi to be vaccinated.
Okay. There has been a lot of conversations about ending malaria, and when we talk about it, it's not just this is what the government should do. I believe it's like a collective effort, but what is it that we can do at an individual basis to at least contribute towards ending malaria?
So I think let's start from the bigger level, because it's mostly like a public health issue about malaria. The way to end malaria is 2 things. So I mentioned about the vector and then the reservoir, which is humans. So vector control, so you need to try to reduce the vectors or them transmitting the infection to the human beings. So the way to do vector control is to prevent them to get into the human. So you use all the nets and everything, or you try to kill the vector. And the way you can kill the vector is using pesticides or using insecticide treated nets, or you can reduce the multiplication of the vector. So there are some efforts to try to sterilize the mosquitoes so that cannot breed, and then you can look at the habitats where they breed and do the habitat management to reduce the habitat. Okay. And that is mostly at a vector control level from the public health point of view, but also the reservoir. As I said, that as you get more and more infection, then you can be having malaria without realizing it. And those are the people, the mosquitoes pick infections and spread it. So there is like chemo prevention kind of mass treatment campaigns where you can go to a region where malaria is endemic and you treat everyone all at once to get rid of the parasites without even testing them for malaria. So that can be done on a seasonal basis, where it's transmitted seasonally, or on a yearly basis where it's transmitted like all the time. Also, there is efforts where you go to schools and you treat all the children regularly for malaria so that they don't become reservoirs and transmit the infection. There are also other efforts where if somebody is admitted with any illness, like a child under 5, then you can just give them treatment for malaria at that time to prevent them from getting infection.
I see. All right. So from where you sit, and I'll take this as your parting shot, because we've talked about ending malaria again over time, and now there's a new goal, that was put in place just recently. So will we ever end malaria from where you sit?
I think the biggest challenge right now is that, the insects also are fighting back.
Yes. And they're becoming smarter. Someone was saying mosquitoes are becoming more smarter now. Yeah.
So they are changing their biting patterns. So you know that you can prevent at this time. Now they're starting to bite at different times.
Yeah.
Then they're also getting resistant to the insecticides. So pyrethroid resistance is on the rise. So you use pyrethroid treated nets, and then they become resistant to that. So you need to. So it's an ongoing fight. Whether we'll be able to end it or not, I don't know. But let's hope that we eventually do.
Yeah, I like that. And what a way to end the show. Dr. Adele Suleiman, who's a consultant infectious diseases specialist right here at Ghana University Hospital. Thank you so much, Dr. for your time. And we hope that we've learned so much from today's conversation, and especially those people who, frequently travel to these endemic regions. Now you know what to do. All right, time now for you to take a look at this health tip.
On our health tip today, we are going to talk about how you can prevent yourself from catching malaria when you travel home to the endemic regions, which is the lake and the coast region in Kenya. There are 2 ways which you can prevent malaria. Either you stop the mosquito from biting you, or you take medications so that even if the mosquito bites you, you can still prevent malaria from infecting you. So how can you prevent the mosquito from biting you? Number 1, you should avoid going outdoors between dusk and dawn. This is when the mosquitoes bite. You should try to stay indoors in a screened room. Try to wear long-sleeve clothing, which is light. On your exposed areas, apply insect repellents. And make sure you sleep under an insecticide-treated net. Despite that, the mosquito might still bite you, so it is recommended to take medications to prevent malaria. Generally, you take the medications a few days before throughout your stay, and for a defined duration after you come back. You can visit your doctor or the infectious disease clinic at Aga Khan for advice on which is the best medication for you.
Well, despite the fact that malaria is easily preventable and curable, it continues to claim millions of lives across the globe. But from today's conversation, I know you know better in terms of the things that you can do to prevent being infected by malaria, and especially if you are planning to travel or if you already traveled to malaria endemic regions. But if you have any other question, our social media handles are down at the bottom of your screen. My name is Winnie Lubembe. A special thanks to the Aga Khan University for hosting us today. Until next Sunday, adios. Welcome to Health Diary. My name is Winnie Lubembe, and we're coming to you from the Aga Khan University. Something happened. Well, while malaria is easily preventable, treatable, and can be cured, treatable and preventable.